Good morning and welcome to all my dears. We had completed the first portion of inflammatory bowel disorder, that is ulcerative colitis. Today we are going to start with a new subject known as Crohn's disease. Like that of ulcerative colitis, it's also a very chronic inflammatory condition of our intestine, and it leads to tissue destruction. Unlike the ulcerative colitis, the Crohn's disease can affect anywhere in our GIT, that means from mouth to anal region. But most commonly, it affects the terminal portion of small intestine, that means terminal ileum, then starting point of the cecum, that means ileocecal junction, and the same may spread upwards. The characteristic of Crohn's disease than that of the ulcerative colitis, it is typically a segmental one, then it is transmural, then non-caseating, and granulomatous disorder. You know that ulcerative colitis is very continuous, then diffuse, and usually ulcerative colitis limits with the involvement of the mucosa and submucosal level. But here, Crohn's disease, if our patient is having Crohn's disease or Crohn's condition, it will affect or it will involve each and every layer of our GIT, that means from mucosa to submucosa, from submucosa to muscularis, from muscularis to the serosa, something like that. That is why it is transmural. And it is non-caseating and a granulomatous disorder also. Let us see which are the pathogenesis of Crohn's disease. Number one factor or number one pathogenesis of Crohn's disease is genetic susceptibility. Some personalities are susceptible to have some particular disorder. Here, the genetic mutations. Second thing is regarding the environmental factors or environmental triggers. And last one is luminal antigen. Let us see about the genetic susceptibility. There are particular genes or specific genes or significantly involved in the production of Crohn's disease. These genes are named as number one, NOD2 gene, NOD2 genes, then number two, CARD15, then ATG16, L1G. There are so many other genes also responsible for the production of Crohn's disease, but these three plays important role. Mutation of these genes plays results in the production of Crohn's disease. Next, about the environmental triggers. As you know, there are so many things that can trigger or excite a condition of Crohn's disease. But in Crohn's disease, number one trigger is smoking. Then alcohol, then abuse of various drugs, especially NSAIDs. Then with our lifestyle of having high spicy, fatty, acidic, oily items, oily foods, etc., or junk foods. So the genetic, environmental factors. Next, about the luminal environment, that means intraluminal antigens or intraluminal infections. As you know, our gut is having so many types of microbial pathogens. Here, the possibility of or the infection of intestine by Mycobacterium tuberculosis, that means intestinal tuberculosis, then infection of the colon by or the intestine by Pseudomonas, then with listeriasis, then cytomegalovirus, etc. plays or etc. may results in Crohn's disease. And regarding the pathology or pathogenesis of Crohn's disease, whatever may be the cause behind the Crohn's disease, basically it affects our immune system. That means the environmental or genetic or intraluminal factors that affects the luminal or intraluminal immune cells which lines the mucosa of our colon. Due to the effect of exciting factors, the normal regulation of immune cells getting altered or disturbed, and thereby unregulated immune response or abnormal immune response or dysregulated immune response or overactive immune response. As you know, the immunes are particularly responsible to protect we people from any form of disorders. But at the same time, the immunes may get irritated by or excited by the so-called causes. So the unregulated or abnormal response of immune cells that causes uncontrolled and severe inflammation of the colon, because the dysregulation may result in unwanted amount of disease producing proteins like cytokines, then interleukin 10, interleukin 2, then tumor necrosing factor alpha 1, like that. Because of all these proteins, that will result in production of free radicals. That means the production of free radicals will hit the intraluminal cells, and following that hitting, that damage or that causes death of the cells, that means necrosis or inflammation or caseations or fibrosis, something like that, changes will follow after the immune response, and thereby total tissue destruction or the organ destruction is the result of Crohn's disease. Let us see the Crohn's disease. As we mentioned earlier, it can affect the GIT anywhere from mouth to anus, even though there are some specialized areas of involvement in Crohn's disease. That it seems that near about 50% of the Crohn's disease that affects the terminal ileum or ileocecal junction. Near about 30% of colon are affected with 30% of patients with the colon Crohn's disease, and near about 20% of patients having Crohn's disease with the involvement of colon, and only 10% may having Crohn's disease with the involvement of esophagus, 10%. So, Crohn's disease can be seen in patient with esophagus, only 10%. Then colon involvement is only 20%, and small intestinal involvement only 30%, and a large percent or more than 50 to 60% of the Crohn's disease patient will have terminal ileal involvement. Terminal ileum. Next, about the epidemiology. Unfortunately, the Crohn's disease usually affects with youngsters or middle-aged personalities. And fortunately, the status of Crohn's disease in India is very rare with comparing with the other countries. It's commonly seen in Europeans or some other countries, but in India it is very rare. But nowadays the incidence of the Crohn's disease is getting more and more in India, especially in Kerala also. And regarding the sex, it affects equally in both men and women, and the age group of Crohn's disease patients usually belongs to ranging from 15 to 35 or 20 to 40 or 20 to 60, something like that. So usually the condition of Crohn's disease is getting diagnosed at the age in between the 20 to 40. But it is let me remind you that the Crohn's disease can affect even in children below the age of 60, and at the same time the same can affect the age above the age of 70. So at any time in our life there is a great possibility of having Crohn's disease, but it is usually affect with the middle-aged in both sexes, and fortunately it is comparatively with rare in India. Next, we have to study with the presentation of a patient with Crohn's disease. Even if a patient is diagnosed as having Crohn's disease, patients will have their own symptoms. That means each individual is having separate set of symptoms. That means no patients having the same set of symptoms. That means a very cluster or a very various levels of or a spectrum of symptoms can be seen in various levels. That is why the Crohn's disease is categorized as mild, Crohn's disease, then moderate Crohn's disease and severe Crohn's disease. And depending on the pathology of Crohn's disease types, it is mild, moderate and severe. And depending on the pathological classification, depending on the degree of pathology, it is classified as just inflammatory, then with a fibrostenotic, fibrostenotic and penetrating Crohn's disease. In inflammatory variety, only superficial erosions or superficial tissue breakdown can be seen. And in fibrostenotic variety, there is scar tissue formation. But in penetrating variety, the inflammation involved or inflammation may go through the entire wall of the bowel, so that there is a great possibility of adhesions, fibrosis, then penetrations and perforations, even up to the skin can be seen. So the symptoms are varying with different levels of Crohn's disease. Next, about the morphological peculiarity, I think that can study in next class. Thank you for watching. Thank you.